Hi, I'm Christine and I'm here today to share with you about skin brushing. I work at a healing center and I work with ladies who have experienced lymph node removal after cancer treatment, and I do lymphatic drainage with them. And in an effort to get them to have a self-help technique whereby they could keep their lymphatics moving, I like them to understand and know skin brushing routine. So I'm going to show you today a skin brush and the routine for someone who has had lymph node removal. And what I'd like to do is kind of give you the direction and the routine for either side and also for the lower extremity. So here's a skin brush. This one was purchased probably at Whole Foods, but you can find them at your local drugstore or sometimes even a grocery store. What I like about this one is you can remove the stick. That's kind of nice. But I'm finding a lot of them you can't remove the stick, and that's okay too. Sometimes it actually helps you to get on your back when you have the stick, but for the purpose of today I'm going to use my own skin brush, which does not have a stick. Okay. So first and foremost, even if you have had your lymph nodes removed or have not, you always start with the neck because it's the main drain of the body. And so you're brushing along this line here from the bottom of the ear to this little well if you shrugged your shoulders. And you brush 5 to 7 times along each side of the neck. And then also 5 to 7 times on the back of the neck. From the back of the skull down to the trapezius or the upper shoulders. So it looks like this on each side. And now you're just starting to get the juices pumping. If you have had lymph node removal of either armpit, then what you want to do is brush in a way that you are moving away from that station. Because what has happened is that station has a little bit of a compromise, and it puts a whole watershed area from your sternum to your waist, around your back, to your vertebrae, and up to your collarbone, including that whole extremity, at risk for fluid accumulation. Which is not to say that you have any kind of swelling or any kind of accumulation of fluids, but if you do, this would be helpful, and if you don't, this will be helpful. So that's where we're going to start. If you've had lymph node removal of the left side, then what you want to do first is the neck, and second is from the left side, you want to cross your sternum and go to your right side, the unaffected side. So you're brushing 5 to 7 times this way, and then kind of lift those up a little bit, and this way. And if for some reason there isn't something to lift, then you can just move away from your scar and then across. The next thing that you would want to do is lift the arm, and from your suture area or the armpit, you want to move down across your waist. You want to be sure, the important thing is to cross the waist. Because you're going over a territory line and you're sending anything that might be accumulated to an area that knows what it's doing. There's no disruption. So you're brushing 5 to 7 times down this way, and then you want to continue and brush the back 5 to 7 times down from kind of your brow line or your shoulder blade, again over the waist. And so now you have completed the trunk brushing away from the affected area. Now on the arm itself, you just want to brush from the top of the hand in long strokes as if you were brushing a horse, all the way up to, again, that little lymph lake that I told you about, that little lymph well. And you want to do that 5 to 7 times. Not on the inside of the arm though, because we don't want to reinforce anything that's already got memory to be pumped there. We are coming all the way up and really heading to the lymph station here. And when we go across, we're heading to the lymph station here. And when we go across here, we're heading to the lymph station here. I don't know if I mentioned that, but you can brush across here also. So that's what you would do if you had lymph node removal of the left side. If you had lymph node removal of the right side, you would flip it. So you would brush across to the left, right to left, right to left, and then down away from the affected area across the waist, and so on across the back, and then once again all the way up the arm, all the way to the neck. Now the beauty of this whole technique is that it mimics the actual stroking of the lymphatic system when a lymph drainage therapist works on you. And I'll show you, when I work on the ladies, I do a technique that actually stretches the skin and creates a little bit of a transient stretch. And when you use your dry skin brush, you are creating that same stretching action so that you are directly affecting the flow of lymph. So that's really the routine for the upper body. If by any chance you had lymph node removal of the lower body, the inguinal nodes at the thighs, then you would pretty much do the same thing. You would brush, you can't really see it too clearly here, but you could brush from the affected area where your lymph nodes were removed out to the edge of the leg 5 to 7 times, and then you would just come up over the butt and over the waist, because in this case you would be sending the lymph that would normally go here all the way up to here, whatever is unaffected. And if by some chance you've had affected areas in multiple places, then you really just need to talk to a lymph drainage therapist or keep moving it in the opposite direction away from the lymph node removal. So I hope that you will try this, because it greatly supports not only the stimulation of the lymph, but it sets a direction so that the lymph can find a new and alternate pathway to an area that is already healthy and working. Good luck with your skin brushing.